Okay, Dhanalakshmi wants to know, doctor, can you please tell me about the diet of CKD patients? Urea is metabolic waste of protein. We are telling patients to take protein every day, 1.5 grams per day or more. Can you clear this?
So let me revisit what we discussed. Protein, carbohydrate, and fat, all three are taken into the body. When somebody takes a lot of non-vegetarian protein, the GFR, which we discussed, actually increases. So when somebody has a kidney disease and they take a lot of protein, they are making the kidney do more work in the form of filtration. It's called hyperfiltration. Even in diabetes, actually, that is what happens. Initially, there is hyperfiltration. Somebody's GFR of 80 becomes 120, 130, 140. This hyperfiltration damages the kidney. So when you take a lot of protein in the form of non-vegetarian protein, when you have an established kidney disease, the hyperfiltration makes your kidney disease progress faster. So by reducing the protein intake, your kidney disease progression can be slower. This does not mean you stop taking protein, because protein is essential for your body, muscle building, fighting the infections, and several other functions. So you have to find a via media. First and foremost, vegetarian protein does not cause hyperfiltration, so you are okay to take vegetarian protein. Non-veg protein, you have to have a measure, and several studies have been done, and we have now narrowed down to 1 gram per kg per day of non-vegetarian protein. So to make it easy, we tell our patients, cooked vegetarian, there is no problem. Milk and milk products to reduce to 300 ml, because milk we take as a non-veg protein. You can take everyday egg, and non-vegetarian like chicken and fish once a week. We avoid red meat because of the hyperfiltration, the amount of uric acid it has, and all that. So to summarize that answer, protein should not be brought down to zero. It is detrimental and causes faster progression of kidney disease, loss of muscle mass, and also you may develop infections, which are very common when protein intake comes down. Having said that, taking too much protein causes faster progression, especially non-vegetarian protein. So we have a fixed amount of it in chronic situations.